your life be like if you or a family member start experiencing one of the following: problems thinking, bizarre behavior, hallucinations, hearing voices, lack of emotion, social isolation, psychosis, or became out of touch with reality? Here's an MRI image that shows brain waves of someone with a normal brain versus someone with schizophrenia. Dealing firsthand with a person with schizophrenia is very difficult and a constant roller coaster ride. My mother was diagnosed with schizophrenia at a very young age. In my freshman year of high school is when she first started experiencing frequent episodes, and was the first time I noticed a change in her. I had no idea what was wrong with her at first. I thought maybe she had multiple personality disorder, which is something that is commonly mistaken for when dealing with schizophrenia. Knowing the facts about schizophrenia can help you become aware of the many symptoms and could possibly help you assist someone suffering from the disorder, schizophrenia. Today I will inform you about the symptoms of schizophrenia and explain the lifelong effects that it has on the person battling with the disorder, like their social life and relationship with their family members. I'm going to start off by explaining the symptoms of schizophrenia. Symptoms of the disorder schizophrenia are delusions and hallucinations like hearing voices or believing that everyone is out to get you, reduced interest, motivations, problems making sense of information, difficulties paying attention, or even remembering things. Reduced emotion and social interaction are very common with schizophrenia as well. Schizophrenia is a brain mental disorder that no one knows exactly what causes it. According to the article Origins and Perspectives of Schizophrenia Research, written by Gabriel Falludi, Peter Doom, and Judith Larsary, the core symptoms of schizophrenia are divided into two groups: positive and negative. These two groups are then complemented by a third group, cognitive dysfunction. Here's a chart of the three groups. The first one is the positive group, which includes hallucination and delusion. The second is negative, which includes social withdrawal or loss of motivation. The third is the cognitive group, which includes memory problems or difficulties paying attention. The symptoms can fluctuate with each person, and they can interfere with your thoughts, feelings, and or behavior. These symptoms have many long-term effects on the person battling with schizophrenia. There are many long effects on a person battling with schizophrenia for several reasons. Number one, although there are ways of treating this disorder to keep it under control, there is currently no cure. Number two, having this disorder can be a financial burden because of the increase of doctor bills and care, because medication and therapy are the most common treatments for schizophrenia. People that suffer from schizophrenia have to make severe changes to their lifestyles, like quitting their jobs or changing their social lives. This can also affect their relationships with family members, like children, parents. According to the article Schizophrenia, Problems of Separation in Families, written by Mathis Angermeyer, Sandra Dietrich, Johannes Junebauer, and Christine Stilling, people with schizophrenia usually only have a few social connections that mainly include immediate family members. Children of parents with schizophrenia are often embarrassed by their parents, and this could cause them to resent them. In an article, in the article "Growing Up with a Parent Having Schizophrenia: Experience and Resiliences in the Offspring," written by Hezi Herbert, M. Majula, and M. Phillips, states that growing up with a parent with mental illness is normally a negative experience, and children have difficulties academically, financially, socially, and emotionally. All in all, schizophrenia is a very serious mental brain disorder that affects family, social life, and most importantly, the person battling schizophrenia. Now that you are aware of the symptoms of schizophrenia and the many long-term effects that it has on the person battling this disorder, like their social life and their relationship with their family, again, I am asking you, what would your life be like if you were a family member who was diagnosed with schizophrenia, like my mother was? It is not something that is easy to deal with, but with a loving family and support system together, you will be able to overcome it.